Recognize signs of senile dementia. The earliest symptoms of the disorder called senile dementia frequently goes unnoticed or disregarded because it closely resembles changes experienced as one grows old. Senile dementia, however, is not synonymous to old age senility. The brain cells, as long as they are healthy, will keep on regenerating and bring about the creation of new neural pathways. Senile dementia, on the other hand, is ultimately the loss of any ability that requires or involves the brain. Its functioning will diminish gradually, leading to progressive memory loss and changes in personality. In some cases, the condition's progression is very slow, while in others, the changes are abrupt. Whether the dementia advances slowly or quickly, the symptoms remain the same. Loss of memory is the condition's key symptom. If you observe that your elderly relative is having difficulties recalling what he has done the day before, it could be an indication that the individual is suffering from senile dementia. Inquire about how the person spent the past few days. Ask about the details of the activities. If that person is suffering from the disorder, he will suddenly look worried and have trouble remembering the details. Recent memories are the first ones to be lost. As the condition progresses, the patient will also begin to forget even long-term memories. At this point, it is important to have somebody periodically checking up on the patient. A person suffering from senile dementia could wander away from the house and easily get lost. You may also observe that the person will develop a tendency to misplace things. Because he can no longer remember where an object is originally stored, the person will also have difficulties trying to find the object again. If you occasionally find a portable phone in your washing machine or a toothbrush in the freezer, then a person in your household could be suffering from dementia. Patients could experience having difficulty communicating. Because of the degeneration of the brain, a patient suffering from dementia could forget simple terms or utilize the words in the wrong way. Often they would start to tell other people something but end up stuttering or simply clamming up. It is not uncommon for these individuals to recall how an object is used but not know its actual name. Most patients will show signs of depression or irritability. Because dementia robs the person of the ability to explain himself, the patient could get easily frustrated and become ill-tempered or aggressive. Some also experiences abrupt mood swings. For fear of getting lost, humiliated, or getting frustrated, a person with senile dementia will opt to become passive and refuse to do anything or go anywhere. they begin staying away from their friends and loved ones. A person suffering from this dementia can lose his ability to think rationally. One consequence of this disorder is the debilitation, and eventual loss, of reasoning. When presented with a task that they used to do all the time, the patient could experience confusion and be unable to perform it. You might find an elderly man having troubles remembering how to put on his pants or how to open a container. In some cases, the patient will exhibit poor judgment or lose the ability for abstract thinking. If a family member exhibits signs that could be associated with senile dementia, early diagnosis is very crucial. By being able to recognize the symptoms, the patient will be able to receive treatments that could slow down the condition's progression. Even though there is no known cure for senile dementia, being able to address the symptoms could entail being able to spend a little more time together.